would like to share with you my results from corneal biomechanical properties measured with the Brillouin scanning. I have no conflict of interest to declare. We know that biomechanical measurement of the cornea is of importance in keratoconus and iatrogenic ectasia, for example. And the existing models for measuring the corneal biomechanical stability properties. We can get one number, but not more than that, more or less. Brillouin light scattering microscopy is a non-invasive technique with the potential for 3D mapping of the corneal biomechanical properties. And we use the BOSS system, Brillouin optical scanning system from Intelon Optics, but we have no financial interest in this device. Now, the purpose of this study was to measure the corneal biomechanical properties in keratoconus before and 6 months after customized Cornea Crosslinking in high oxygen, which is our standard method of that we use for crosslinking today in my clinic. And the possible relation to the corneal thickness and steepness in the corneal points that we measure the stability in, and to compare these values with healthy individuals at different ages. The setting was Umeå University Hospital, where I work, and this is an ongoing study. We so far included 45 eyes of 23 individuals with keratoconus, and measured them before and 6 months after this customized cross-linking treatment. And we measured 139 eyes of 70 healthy individuals from 10 to 45 years of age. And we did pentacam in both eyes, and we did BOSS measurements in 10 points of both eyes. Now, here we can see the controls first, and you can see that the cornea has a rather uniform stability over in these 10 measurement points. And if we look at keratoconus corneas, you can see that they are less stable in the central part and also in the inferotemporal part. I can say also that the left eyes in this study were mirror imaged to go together with the right eyes. So temporal is always to the left in the picture. But these values were not related to tangential curvature or pachymetry. So the Brillouin measurement indeed measures something different than that. You can see the same thing here as graphical representation, and these values were statistically significant, mainly inferior and central inferotemporal mostly. If we look at healthy individuals, you can see that there is a weak correlation between the age and the stability of the cornea. So the cornea gets more stable with age. Now, these were the average treatment zones that we used. You can see that we treat with the lower energy generally in the 6mm zone and higher energies over the cone. These are average values, so they differ from patient to patient, of course. Here you see an example of the treatment effect, and you've all seen this, that the delta tangential curvature is more than 12 diopters in this case, so it's rather a profound effect on corneal shape after treatment. But what about the corneal stability after treatment? Well, this is what it looks like before treatment, as you remember, and this is what it looks like after treatment. And you can see that if you in particular look at these points, you can see that there has been some statistically significant changes right where we wanted them. The same thing looked at graphically before and after treatment, and these values were statistically significant in our group. And if we superimpose the treatment fields over this field, you can see that where we gave the most energy, the cornea stabilized the most. So that's what we would have guessed before treatment also. Whereas in the periphery, where we only treat very little, you see no effect on the corneal stability that can be measured with the Brillouin. So to conclude our results, the Brillouin values do not translate directly to corneal steepness or pachymetry. It measures something different. The reduced biomechanical stability in the central and infratemporal cornea can be seen in keratoconus, and this increases after crosslinking and increases with age also in healthy individuals. This is an ongoing study, as I said. The Brillouin measurements is a new measurement modality, and it appears to be able to quantify and map the reduced corneal stability in keratoconus and the stabilizing effect from crosslinking. Thank you very much.